Good morning, all. With great pleasure, I'm pleased to invite all to the 4th edition of InnoHEALTH conference. Having a mission to bring the top healthcare experts and stakeholders to discuss and to deliberate on interventions which endeavor to bring down the cost of healthcare delivery and improve the quality of healthcare. I would like to welcome all my prestigious inaugural invitees and would ask Dr. V.K. Singh to please present them with a rosebud. May I now ask Dr. V.K. Singh to please come and set the tone for the event.
Good morning, ladies and gentlemen. This is our 4th conference international, and we are really glad to welcome the guests on the dais, and also the speakers and participants. We have cut out all those traditional things of lamp lighting, etc., straight on the business. And I'm only very keen to keep the professionals as an inauguration so that we can share more better perspectives. So we have people already. She will be introducing you. Just to tell Mr. Karnal Singh, who was Enforcement Director of Govt of India, then the General Pant, who is now in the Prime Minister's office in charge of all the cyber security issues, and Dr. Yasmin Ali Haque, she is heading UNICEF representative to Govt of India. We have created a lot of upbeat. There are more 276 people who are registered, but unfortunately, as you know, traffic or our own culture, we take our own time to reach. So I apologize to the guests, chief guest and others, that this may be taken as the Indian Standard Time or Indian culture, though it's not appropriate. We have a good partners. We have people coming from the USA, UK, Israel, Portugal, Estonia, and so on and so forth. We also have our country partners, Canada, Israel, LIC, IIM, and Public Health Foundation of India, Onquest Business Region of Sweden and Gothenburg. Ultimately, what we are really looking for is how to create healthcare delivery at optimum cost. Use technology and yet keep the quality. I had insight to start this, I being from the uniform itself, that after I wrote books published in US, because Indian publisher thought army fellow will not be able to write something. He's not academician. They are on the counter, you can see. First one got international award of 2018. And ultimately what really I wanted to bring on the table, that no writing and no talking. That's what in IIT Kharagpur, when I was giving keynote, they told me, all my professors teach, show it on the ground, what can be done. So I picked up Sachin, who is double master in cryptography, ethical hacker, and also mobile security. He got National Innovation Award for bringing in Sabarkanta infant maternity mortality rate, which will be very close to Dr. Yasmin by heart. We are trying to see and bring people together how best we can take first step. And that is it. Some of our organizational are not-for-profit, like club, etc., which is there in your kit. You can see what we do. Last time, ladies were very upbeat about it. We should have something for lady entrepreneur. How can you do that in India? All girl child we talk. So we have the ladies entrepreneur, and by default, every session have a keynote speaker, apart from the Dr. Yasmin in the inaugural. There are 5 apart from her, out of the 8 keynote speakers who are the ladies. So I hope ladies in the hall are quite okay with that. We are trying to build up that how we can do, right, the grassroots level. We have got a theme called Unmet Needs Lead to Innovation. I'm a firm believer that technology can do marvel. Technology can also do a problem setting. I had sent Sachin along with the IIM Ahmedabad team to Nagaland to pick up grassroots innovators. Well, there are two experts, rather three I can say, who are in cyber, as would be, and we had, and they are resolving the problem that we had a problem at the cyber issue at the airport. A professor, very senior professor from Sweden has agreed to come because they wanted to share what diabetes research have been done. We have met her and we hosted some panel discussion in her Sweden as well. And she was taken that she landed like a good person. India has so many people on receipt. You get the visa. She applied. Genuinely, she applied. She was taken to some other website, which was fake website, and it was hacked. And ultimately, she was told on the airport that you cannot go inside and you have to go back. These are some issue technologies which you have to accept and will take some time to resolve it. But you can see from the person's point of view, I'm sure the people here, some of them have taken interest, and she is being resolved, and she might be letting in. Otherwise, she will come all the way and she will go back. Good lesson is, as a good doctor, I do that believe technology to some time. I will never like to take any online visa. I'd rather take it beforehand. At least I'm at home, etc. So many of us who believe technology, and technology is really wonderful, but you got to say pinch of salt. That man has made the technology. I'm talking in the health sector. And we are master of technology. You should not become subservient to technology. Like billionaire Khosla says, I don't need doctors. Computers can do everything. I was happy yesterday when we were talking of artificial intelligence, one-day workshop. One doctor who has done a lot of work in Gujarat says, artificial intelligence, I do ECG in 30 rupees. Rajkot, I have got a hospital which is better than Apollo equipped, and 300 rupees for other procedure in my cardiac cath lab. This is kind of a technology, this kind of a step. For India, we are thinking where we have, you understand, economy, landing on moon, yet bullock carts are there. We have only 1.4% of GDP spent. Also, we would find WHO say 3.5 bed per thousand population. We reached only 1 bed per thousand population. Let's work out on a public health, preventive aspects, use technology, and take it to India forward, because present government talks about Fit India, Swachh India, and Ayushman Bharat is one of the such initiatives. I'm sure with all the people who are sitting here, young and other senior ones, we will take this thing forward and we'll do something for our own country. I'm grateful to the dignitaries on the dais that they came all the way, and we'll spend some time and spend their given time. I'm also grateful to all the speakers who have come from all the way from abroad on their own, and other people here. Thank you very much.
Thank you, Dr. Singh. I would like to, with great pleasure, now invite Lieutenant General Rajesh Pant, who is also our guest of honor, to come and say a few words.
Dignitaries on the dais. Ladies and gentlemen, good morning to all of you. In 1897, the printing press was invented by a gentleman called Gutenberg, and the great American humorist and novelist Mark Twain said, and I quote, "Gutenberg's invention created a new heaven, but it also created a new hell," unquote. This is what technology is all about. This is what Admiral V.K. Singh I just spoke about. I have been given 15 minutes to give the inaugural address, and I will divide it into 3 parts: where I come from, what I do, and what I would advise on the InnoHEALTH seminar that we are having today. Firstly, my compliments to the organizers. It's a beautifully curated event, and it does exactly what innovation requires, a multidisciplinary sort of approach. So in that sense, compliments to you, sir, for your initiatives. Admiral VK Singh has always been a great motivator for all of us. In fact, all VK Singhs seem to be doing well in life. We have a General VK Singh also who's become a minister. So part 1, where I come from. Where I come from is the National Security Council Secretariat of India. The highest body in our country which takes decisions on national security is called the National Security Council. It is chaired by the Prime Minister of India and comprises of 4 ministers: the Ministers of Home, External Affairs, Education, and Finance. And the Secretary General of this council, this is what the National Security Council comprises of, and the Secretariat for briefing Mr. Doval on all aspects is provided by the National Security Council Secretariat. So we have about 4 or 5 verticals. We have a vertical headed by a very senior Indian Foreign Service officers who talks of strategic threats. We have a vertical headed by the ex-director of the Research and Analysis Wing that talks of the threat intelligence. We have a vertical headed by an ex-IB director, Mr. Ravi, who's recently been posted as Governor of Nagaland. And in fact, we have a military advisor also, another Lieutenant General officer who provides information on military inputs. And I head the vertical on cyber security because, in a sense, it touches everyone. And what basically we are doing is that we are giving the pros and cons of every decision so that the Council and the Prime Minister can take an informed decision. Whether it is Balakot, whether it is Uri, whether it is an anti-satellite test or some other major things that have happened recently, the entire analysis, etc., is done by the Secretariat and presented to the National Security Advisor. Why it is important, taking an informed decision? Because what they say that in 1947, when the raiders came from across in Kashmir, the Indian government and the then Prime Minister decided to go to the United Nations, whereas the matter could have been solved bilaterally. So these are the level of decisions, and because of that decision, till today, we are fighting this sort of a war, if I may say so, in the United Nations, that it is a bilateral issue. So the level of decision-making is very important. Strategic decisions are taken, and it makes a lot of difference in the history of nations. So that is where I come from, the National Security Council. What do I do? As you're aware, cyber touches all of us. In fact, you have this contraption in your pocket, the smartphones, from which you get connected to the internet, and that is where you do all your banking, etc., and that is where the threats come. So in India, we have something called the National Cyber Security Policy, which gives out the framework as to how we are going to tackle cybersecurity in the country. In fact, my appointment, the National Cyber Security Coordinator, was created out of this 2013 policy. And we created something to take care of our National Critical Information Infrastructure, an organization called NCIPC. We created something for the incident response called the Computer Emergency Response Team, CERT India. And we created some other organizations for handling cybercrime, etc. In fact, for the cybercrime part, for your information, we have a very good portal, cybercrime.govt.in, which in fact I found when I took over that 90% of the crimes being reported to that were not being handled by them because they are only expected to handle crime against women and children. But a lot of these bank frauds, etc., were being reported to the cybercrime.gov because the law and order being a state subject, this is handled by the cybercrime cell of various states. So there was a mismatch there, which we've just sorted out, and we have created an Indian Cybercrime Center, I4C, And this portal, now if you report a crime on this portal, even if it does not pertain to them, it will go to the concerned state, the concerned cybercrime cell. So that's something good that has happened as far as the country is concerned. And I hope, I don't hope that you report a cybercrime, but at least you can spread this news around that cybercrime.gov.in is now taking care of any cybercrime that takes place in the country. So 2013 this policy came out, and as you know, in the last 6 years, I mean, the entire threat surface has changed. When I say threat surface, I mean how the cybercrime is being carried out. It is not only frauds and breaches, it is data thefts, there are state-sponsored attacks, there is something called ransomware. Ransomware is something that affects the health sector very seriously. If you see the BBC News of 2nd October, there are 3 hospitals in Atlanta which have been subjected to a ransomware attack, and the entire hospital has been shut down. There's a board outside the hospital, please go somewhere else. So that is the impact of a ransomware attack, because your entire information of the patients is not there. You cannot send the tests from place A to place B. In fact, you probably cannot do the tests also because of this automation that has come into this sector. So this part is going to be in my part 3 also. But coming back to the cybersecurity policy of 2013, a lot has changed since then. So what are we doing? What am I doing at the moment? I'm crafting out a new strategy which is called the National Cyber Security Strategy 2020. It is going to be released in January next year. It is going to give out our vision and our objectives and the strategy we will follow for the next 5 years. So the strategy is going to cover from 2020 to 25. Vision, objectives, by and large, we have been discussing over the last few months. Things are in place, but still we are going to put it out in the public domain, and all of you or any of you who wishes to give any comments from India or abroad are most welcome to tell us as to what do you think should also be included in the Cyber Security Strategy 2020. So that is what I'm doing. And the last part is, what do I advise? What I advise is something that was told to us when we got commissioned, at least when I got commissioned in 1973. The first thing we were told is, when you go to sleep at night, ask yourself 3 questions. What have you done for your profession today? What have you done for your family today? And what have you done for your health today? And the last part is the connection between all of us. So these 3 questions are still very relevant. I served only 41 years in the army. So as far as the health sector is concerned, the ransomware aspect is what I've told you. In fact, in USA, there have been major ransomware attacks. Baltimore City, Florida City paid $460,000 in bitcoins to overcome that ransomware attack. Baltimore did not pay because they had a policy that we will not succumb to terrorism sort of thing. But they've actually spent much more in trying to resolve their problem. And as I said, 22 cities recently in Texas have been hit by ransomware in the month of August. 22 cities, entire cities are crippled. You know, the transportation system, the aviation sector. You can imagine what can be the seriousness of a ransomware attack. So coming to the hospital sector, as Admiral V.K. Singh said, that more and more technology is coming in. But with that technology, are the security practices also coming in? That is what I worry about, as to how wide my threat surface is going to become when all this technology comes into the health sector. Just imagine a robotic operation going wrong or some results being altered. What is the seriousness of that? And hospital administration, in any case, the hospital information management system, etc., is all based on automation. And just a malware can wreak havoc. And how does this malware come? You can have a separate system, you can have an air gap. But in our profession, day in and day out, we are told as to how this air gap is jumped. And you'll be surprised, things can come through cameras. Like in one hospital, they had a surveillance system of cameras. And they had a surveillance center where all the viewing was done on the television screens. And from that to the hospital system, there was a connect, because they wanted to be warned if something is there. So that is the connect that this hacker took advantage of. And the malware was in the camera. And through the camera, it came into the hospital system. Then there are USB drives. You put a USB drive here, you put a USB drive there, and the malware is transferred. There are 101 techniques for even jumping the air gap. That means if you have a a separate private sort of a system inside the hospital and you say, no, I'm not going to be internet facing. So even then the malware can come. So my last advice that I said in part 3 I will give is that please think of the risks before you are going in for any high technology equipment. What are the risks? Because cyber security is all about risk management. How do I manage this risk if something goes wrong? And there is a concept called security by design. That means when you're buying something, have a security part inbuilt into that. That is what most of us don't think of. We buy the equipment, it looks nice. You say, okay, 64 slice CT scan, wow. And he'll sell it for that figure that he was mentioning, this new clinic that has been opened. But what about the security part of that? What is the new feature that is put to ensure that it will give us the right results and we can trust that equipment? So that is a note I want to end on. And these are the 3 things I thought I'll cover, where I come from, what I do, and what I would advise, that please think of the security by design aspect whenever you think of any medical equipment. And on that note, thank you very much for having me here. It's been a great event. Thank you. Jai Hind. Thank you.
I just wanted to mention there's a magazine in your kit which goes to 76,000 people through Amazon. His interview is published in that. So you can also read that to fill up the gaps. Secondly, Dr. Yasmin had given an interview in earlier and Karnal Singh in earlier. So all the people who I have a lot of regard and respect that they can give some knowledge to others, I put them as a guest scholar. Thank you.
On that note, thank you, Lieutenant General Dr. Rajesh Pant, for providing us insights on cybersecurity. While we focus on technology, we should also be aware of the risks which are associated to it and how we should be able to overcome those. I now request Dr. Yasmin Ali Haque to present a keynote to the audience.
Ladies and gentlemen, Vijai and dignitaries on the dais, I do have to apologize as being one of the people who was late coming in and responsible for a delayed start, so my really sincere apologies for that. I'm going to talk about how unmet needs, whether especially in the health sector, becomes the mother of innovation, how needs are what actually drives innovation. And then go a bit into how technology is one of the solutions to address those innovation. And I think more and more as we work in it, and when we hear of, we heard a lot about the cybercrime aspect, we heard about us having to be aware of the risks of technology, but also mitigating those risks. And understanding that innovation is also not just about technology. Innovation is about solutions that are available for a problem that can be taken to scale, solutions that haven't been used before. And whether it's through technology or through some other forum, it's how do we reach scale? How do we reach the millions of people that we need to? And that's where I'd start with some reference to the 2030 Agenda for Sustainable Development. The world has resolved to leave no one behind. As we signed off on the SDGs, it's really important that we keep an eye on some of the commitments we've made to ending extreme poverty and preventable child deaths, and really looking at integrated action across all sectors to address some very complex issues that we face. The world, on the other hand, you can see that how increasingly connected we are becoming, how much more opportunities there are, especially when we look at the fact that 95% of the global population, which is about 7 billion people, live in an area that is connected by a mobile cellular network. Can you imagine? 95% of the global population can be connected, which is massive. And nearly 41% of people in developing countries have a mobile broadband subscription. And I think in countries like India and many places in Africa, it's not just one mobile connection. We have, how many people here carry more than one mobile phones with you? So there's so many connections that we see that are happening. So very clearly, if we are to achieve the goals for 2030, we will not be able to do so without really paying due attention to technology, to innovation and partnership, because we cannot work in silos. The different cellular companies, if they did not allow us to talk to each other across cellular companies, we would not be getting anywhere. So that partnership factor is going to be extremely important. Improve network speed, efficiency, cloud computing, device connectivity, data analytics. These are accelerating conversations with really a strong promise of digital health also. With digital health, we have an opportunity to invest in the policy, people, processes, and technologies that allow us to leverage data to improve health systems and health outcomes for billions of children around the world. The UN Secretary General in 2018 has also very strongly taken on the agenda of how we work with technology, especially for reaching the goals. And he's asked us to narrow the gaps, bridge the divides, rebuild the trust by bringing people together around common goals. Unity is our path, our future depends on it. And of course, if we are not healthy, then our future is not going to be looking very rosy at all. So why does good health matter the most and what are the unmet needs that I mentioned? So we have seen tremendous progress in the world in improving the lives of children over the past few decades, yet there are still unmet needs in all age groups. Well, firstly, the number of children dying before their 5th birthday has declined a lot between 1990 and 2015. But still, there are millions more preventable child deaths every year. As the global population keeps increasing, we will see the numbers still remaining in their millions. If we look at stunting, which is a form of malnutrition where children are not growing according to the height and weight that they should be, stunting prevalence among children under the age of 5 fell from about 33% to 23%, which means 43 fewer million children being stunted. Yet, we still have millions more who are. Globally, 32 million people died in 2016 due to cardiovascular disease, cancer, diabetes, chronic respiratory disease. The probability of dying from these causes was about 18% in 2016 for people between 30 and 70 years of age. So as the infectious diseases are coming down, as the profile is changing, we are confronted with a different disease pattern among the population. Unsafe drinking water, unsafe sanitation, and lack of hygiene continue to be major contributors, resulting in still hundreds of thousands of deaths. And they're mainly still due to diarrheal diseases, due to malnutrition. So some of our basic challenges still continue. In India, if we look at even the issue of accidents, road accidents, every year hundreds of thousands of people die from road accidents, which means their families, their children, the parents are affected, and some who survive are again burdened with the disability that goes with it. Now, Vijai talked about how many beds per person we have here, and also globally, we see that it's not just the bed availability, but it's the cost of healthcare. And 12% of the world's population, which is over 800 million people, spent at least 1/10 of their household budgets to pay for health services in 2010, up from 9.7% in 2000. So while technology is improving, while solutions are increasing, we still see that the health costs are increasing. And I think that's the point that we heard, that whatever innovation or technology we're looking for, if it is not bringing in cost efficiencies to the family, then we're not really progressing in the way we want. Ensuring healthy lives requires a strong commitment. The benefits do outweigh the cost, and healthy people are the foundations for healthy economies. It's estimated that if we spend $1 billion in expanding immunization coverage against influenza, pneumonia, and other preventable diseases, we could save 1 million children's lives every year. In the past decades, improvements in health and healthcare led to a 24% increase in income growth in some of the poorest countries. And just in India alone, we have found that by having in place safe sanitation, a family would be able to save up to 50,000 rupees a year, either in health costs which they don't have to incur, or preventing income loss or loss of days going to school. So the investment case, the economic benefit of healthcare and investment in healthcare is crucial. The costs of not preventing safe driving on the roads, use of tobacco and alcohol, and allowing our environmental degradation without proper healthcare and affordability, it pushes many people into poverty also. So it's really important that we not just see as what the opportunity costs are, but also what is happening to those who are not able to afford it. So if I look at my own organization as UNICEF, we have a very ambitious agenda of reducing child deaths, reducing disease, reducing malnutrition, and we're really working very closely with governments and civil society partners in many countries around the world, in about 145 countries around the world, to look at what are the solutions that can be taken to scale so that we can be seeing the world as a better place for children. Core to our strategies and how we do it are three key areas that I'd like to highlight. One is leveraging the power of business and markets for children. It's not just about governments anymore. It's very much about how civil society organizations, the business sector, and the private sector are engaged. It's about fostering innovation in programming and advocacy for children. Like any long-standing bureaucracy, it takes us time also to really embrace new things, new technologies, new ways of doing business, but it is core to our strategy. And within all this, using the power of evidence to drive change for children. And I think that's where it's really important that whatever innovation and technology we take forward, we're very clear on measurement of is it making a difference or not. And if it's not making a difference, let's move on to something else. It's very important that we embrace failure, that we accept failure and move on, and not keep trying to reach the same end through a means that we know does not work. For UNICEF, it's really important that we see the world where health and well-being of children is improved through health systems that are also digitally enabled, in which the health technologies are used to enhance quality and reach, and that the services for the most disadvantaged children and their families. And I was recently in one of the tribal districts in in Jharkhand. And there I saw in the Health and Wellness Center also they are looking at how e-health can be complementing the existing health services that are available. Again, it's a matter of how are we testing it, how are we measuring it, how are we looking at the return on investment that it takes. I totally agree with the fact that innovation has to be informed by human-centric design. So it's not just about a solution, it has to be a human-centric solution, something that takes into account the needs of people, that looks at an implementation strategy that has a system-wide view. And what would be the success criteria if we were to be looking at some innovation related to that? It would have to be, one, that it saves time and money. So making low-cost trials of innovation programs before scaling the solution, going in quickly, I think that is not an approach we would advocate. We have to be very clear about, before we invest in large-scale efforts, that we are very clear about the returns on that investment. The second criteria we would think of is that it is pro-equity, that we look at using technology for especially reaching the last mile, as we call it, the last mile of reaching people either who are geographically out of reach or who are socially out of reach. How do we get to them? That it brings in a systems view, not something in isolation, but can be connected. The fourth criteria would be looking at that it in itself helps bring about new solutions, that provides the opportunity for new thinking. And fifth, really looking at how we can close the empathy gap. And I think it's really about empathy, meaning having an understanding of the situation the other is in. So how can we reach that empathy gap through innovative solutions that would include technology too? I think India has taken the whole issue of technology and innovation to heart. The number of different solutions that we see every day coming up are really exciting and heartening. And I really believe that if we can look at coming to clear criteria on what the measures of success will be, it'll be very, very important that we do that. If we look at the challenges that are likely to be coming forward that need to be addressed, one is that we try to move away from verticals. A lot of our health innovation technologies have also become vertical, and then integration becomes a problem. So unless we step back and look at all the spheres that need a solution, and we already look at how they can be connected, how they don't become discrete, it'll be important that we do that. The second is creating the partnerships between different types of organizations, including service providers, drug suppliers, phone operators, IT platforms, etc. Looking at business models that combine markets, philanthropy, and government funding. It's really important that we not look at one source of funding that goes to it. Privacy and government capacity to analyze big data, to keep an eye on are things going in the right direction. I think that's, again, something that would not be sort of a crime issue, but really looking at how do we prevent such use of data becoming harmful for people. And then, of course, regulating the healthcare, drugs, and information technology so that we don't end up creating harm in the process. So I understand here we will have people from the public sector, entrepreneurs, startups, and all of you have a huge role to play in these priorities. You will be bringing together information on new and improved technologies, new delivery models, looking at pathways to address the problems. I would urge you also to look at the pathways to address these challenges in a sustainable manner, so that we don't move along and then realize that we haven't accounted for the challenges. It will be important that we have a suitable public policy to help the process. And of course, the affordability. That's something I'll keep coming back to. Not just the immediate affordability, but the long-term affordability. India, with its vibrant technology and talent pool, has been leading the development of many products and technologies, so it's a great opportunity here. India already is a major producer of life-saving vaccines, medicines at affordable cost, and we have witnessed an explosion in the number of tools available to collect, filter, integrate, analyze, map, and visualize information collected from the field for leaders and for decision makers. The important part is, are we using that data? How are we using the data? Is it feeding back, and is it leading to improvements? And I think this is where we have to keep challenging ourselves. The emerging technologies represent an extraordinary opportunity to close the information gap, and it's really important that we keep that center to it. So what can we all do to achieve these needs? We can start by promoting and protecting our own health. So I'd echo what the General said about what have you done for your health today. The health of those around us by keeping well-informed choices and taking use of all the preventable behaviors and technologies that are available. We can raise awareness in our own community about the importance of good health, healthy lifestyles, and especially those who we see are more disadvantaged in society. We also, I think, as a community, we have to hold each other accountable for the commitments we make and to improve people's access, and really to encourage everyone to, again, innovate newer and more affordable technologies, solutions, and ensure that public and private sector support the best of the brains. As much of the resources, both human and financial, can come together to really look at how we can be addressing prevention being better than a cure. Thank you very much.
Thank you, Dr. Yasmin. Astonishing statistics presented by Dr. Yasmin. What struck a chord with me while sitting there and listening to her was solution, but a human-centric solution. Empathy, especially when it comes to healthcare. It is, I think, critically important and something which should all think about. I would now like to invite Mr. Karnal Singh to deliver a special address.
General V.K. Singh, General Rajesh, Ms. Yasmin, Mr. Sachin, ladies and gentlemen, the topic today is unmet needs leading to innovation. Mr. Narayan Murthy, co-founder of Infosys, recently said, there is not a single innovation from India in the last 60 years that became a household name globally. India had not produced any idea that led to earth-shaking innovation to delight global citizens. This coming from Narayan Murthy has some meaning. Are we so bad? We take example of Israel. Israel is a partner in this seminar. I was in the investigating agency. Most of the spywares, interception wares, they are coming from Israel. That country is developing so many things. Why we are not able to develop? Somebody said that out of 1 rupee subsidy to be given, only 15 paisa reaches. May I know who said this? Anybody? The then Prime Minister, Rajiv Gandhi. How many years it take to find the solutions? 30 years. Now we have the direct benefit transfer scheme and no pilferage. It took 30 years to find a solution to this problem. Are we thinking? That is a question. Are we innovating? Are we thinking differently? I was investigating a blast cases in 97 in Delhi. There were 42 blast cases. No solution was there. To find out a solution, what we did is, on all the different types of blast cases, we took the data of mobile, the mobiles were not there at that time, they were just coming, of the MTNL phones from Delhi to Pakistan. Analyze it to find out if there is in each, after the each blast or before that, there was any call to Pakistan. We found shortlisted around 12 numbers. What was the need of the investigating agency? That any call made to these numbers from India or from these numbers coming to India, we should be able to hear. I approached VSNL, Videsh Sanchar Nigam Limited, which was the main agency at that time for the foreign calls. They said it is not possible. We don't have the software and it is not possible what you are asking. I'm from engineering background, so I had a friend in MTNL. So I was discussing with him. I was asking him if you can detect 3 digits to decide whether this phone call will go to foreign country or to Indian country. Then why can't you examine the same software, another 3 digit and another 3 digit, completing the 12 digits? So he says, I'll find the solution for us. He actually developed the software where any call made from Delhi to Pakistan, we were able to hear. But our need was all over India. I again approached VSNL, they said it is not possible. Then I talked to the Ericsson. Ericsson was the switch which has provided to VSNL. They say they have inbuilt software available. If they want, they can provide, but at a cost. The meeting was held in MHA. Home Secretary intervened. He actually almost threatened the VSNL head, saying that if you don't provide the solution, if that is possible, heads will roll. And within 3 days they purchased, and within 1 month, the accused who were causing blast after blast was caught. The question is, you have to think differently to find out the solutions. We are closed mind. What type of education we get in the colleges or schools is to go ahead to the others. It is a competitive, it is never a collaborative. We have so many needs. It could be needs of the different agencies. It could be needs of the rural area. It could be needs of the industry. For example, the Security and Investigating Agency requires simple call data analysis. Most of the best analytical tools have been developed by Israel, not by India. Face recognition, CCTV analysis, big data analysis. I was in Enforcement Directorate. Even the income tax, we require the financial data analysis. This is a requirement. Not a single Indian solution is available, it is a US solutions available. We take medical field. There are many injections which are required to be kept in the freezer. For example, insulin injection. Is the electricity available in the rural area, most of the places? Round the clock, it is not. Can we find a solution? Diabetes, can we find the tablet for insulin? Of course, there is a research going on all over the world. 3 years ago, I read in the newspaper that IIT Delhi has developed the technique. But nothing could be heard thereafter. We are good in putting news in the newspapers. What we are doing, how good we are, but what are the results? And another question is, how do we provide healthcare in rural India? What type of equipments we require? What way telemedicine can be used or any other techniques can be used? One has to find solutions. Are the needs which are there are communicated to the people who had to find the solution? The colleges, medical colleges, engineering colleges, are they in touch with the reality of industry? Are they in touch with the rural people? Are they in touch with households? Unless one is in touch with them, solutions cannot be found. The requirement of water for agricultural purposes all over India, all over the world, as per World Bank paper, is 50% of the total water usage. India, it is 80%. Are we looking into this? How that the water usage in agricultural field can be improved? A few days back, I was coming from Bombay to Delhi in a plane. A sick gentleman was sitting beside me. He was sleeping all the time. Before the plane could land, he got up. He asked me, what do you do? I told I am a retired government servant. I asked him, what does he do? He says, I save water. I was a bit shocked. What does he do? Then I started asking him, what do you mean by you save water? So he started telling me, do you know how much water is consumed in thermal power plants? He says if we can save that water in our country, it will be good for more than 3 years of human consumption. And he sent me an email giving all the calculations. Are we looking into all those things? How can we conserve water in thermal power plants? There could be solutions. There are solutions. The 2010 to 2020 has been declared by India as Decade of Innovation. And what was our rank in innovation in 2015? 81. Niti Aayog prepared a paper which was presented to government in 2015 that how we can innovate better. And thereafter, Government of India brought a lot of schemes. The one is Atal Innovation Mission. And they started from each level, like institute level. For the schools, Atal Tinkering Labs or Mentor India. And they have covered by now 8,878 schools in this scheme. Then Atal Incubation Centers in various universities and colleges. To support technology development, because once somebody is innovated, then it has to be supported, it has to be commercialized. They have come out with Atal New India Challenge. The another scheme is for small enterprises, which is known as Atal Innovation for Small Enterprises, ARISE. And to find out the grassroots level innovation, Atal Community Innovation Centers scheme has been formulated and it is being used. Now the issue comes of patent. If somebody develops something, somebody may take away his innovations, his invention. So National Intellectual Property Rights Policy was introduced on 12th May 2016. There is an innovation portal of Government of India where one can find out what are the latest innovation being done. Latest, there is a challenge. The Innovate with India, Change the World contest. One can find out on this Innovation India portal that. Then there are Startup India schemes. A lot of schemes have been started by the government of India. It is an initiative of government. There is an impact of this. In 2019, we were 51 in World Innovation Index. From 81 in 2015, 51 in 2019, and the target of government of India is to come below 25. China is at the 17th number, far above us. What we require is to change the culture. We have to inculcate scientific culture. We have cut and paste culture actually. If somebody asks me to write an article, I'll just go to net and cut and paste from here and there and make a very good article, forgetting about what plagiarism I am doing. We have to leave this culture. We have to think differently. We have to think for the people. We have to think what is the need of the time. Innovation will come. In the field of medicine also, same thing. A lot of things are required. Measuring, for example, blood pressure with electronic. How accurate it is. So many things can be done. We are the best in the world, technologically. This Pentium chip was made by one of the Indians, Vinod Dham. He is my senior from my college. Why we can do so good in the foreign country and not in India? That is a cultural difference. I hope with the intervention of Government of India, with the intervention of NGOs, with the intervention of people like General V.K. Singh and his team, we can innovate, do better, and show our strength. Thank you very much.
Thank you, Mr. Karnal Singh. What I could hear while hearing Mr. Karnal Singh speak was, need is the mother of all invention. And we can now safely say, innovation is the mother of all, need is the mother of all innovations. Now I would like to call upon Dr. Singh to do a book launch. Is Mr.
We started that the young innovators can write something and we launch their work. So there's another innovator who has given the work to everyone. The first one, small book is written. We also have Young Innovator Award for less than 35 years of age, and they are the one had that application, and we have shortlisted 5 of them who will be presenting and we shall receive the award.
Can I call on stage Mr. Ravi Jongi if he's in the audience?
There is a writer, yeah.
Thank you, Dr. Singh. Thank you, Mr. Ravi Jongi. I would now like to invite Mr. Sachin Gaur to say a word of thanks.
So, a warm good morning to all of you. And my role here is very limited. But, sir, I would just like to follow up on the few lines that you said. So, General Pant mentioned about multidisciplinary. Sir, I just like to report that we did a AI workshop yesterday, AI for healthcare. And we had around 20-25 people in the room. And they were coming from all walks of life. Even in this room, there are some clinical doctors who are now doing IT, and there are people other ways. So this room is full of, such people. And so the biggest challenge to do such a work is that to develop that language, because most people coming from different walks of life, they do not share the same vocabulary. And that's the first hindrance, sir. So in last 4 years, we have managed to develop a community which somebody yesterday was saying that we need to respect each other. And I think we are able to, get onto that path, sir. So second thing I like to bring to your attention, sir, is that, AI right now is a buzzword, as you know. And I think there are regions around the world which are talking about ethical and security issues related with AI. And I think, especially with the medical community, sir, so there's a trust deficit. And I think your good office can actually, do some initiative which, let's say in future, when people bring in, those solutions in a big commercial way, there is trust in ordinary citizen. There is trust for clinicians, because most of the AI debates today, they boil down to, AI will replace jobs, And I think, from the Prime Minister's office that AI is the highest topic on the agenda, and it's about assistance, it's not about replacing. Coming to you, ma'am, you talked about embracing failure. I think that's very important, and I think a lot of us here in this room have dealt with failure. And I think we have tried to create an environment where failure is not looked down, but looked upon. And we will follow up, ma'am, with your advice. And we also, what Nishta mentioned, that human-centric design is very important, especially when we do any of our meetings, we make sure that the clinicians are in control. Because many times what happens that, a lot of IT people come, and, it creates sure that whether it's a patient-led discussion or it's a clinician-led discussion, so that we bring in, equity of all stakeholders. Then you also, ma'am, talked about business models, which is, I think, is very, very important factor, especially when we have our friends from other regions coming. Those same business models will not work in India. India is a market of volume, not, as you rightly said, about affordability. Coming to you, sir, I think you really inspired me, and I think the room was totally silent when you were speaking. I think we all have the guilt. We are all guilty here in this room that, we like to think ourselves very highly, but in reality, like you mentioned, So I think what I borrow from you, sir, is that critical thinking. And sir, you also mentioned about, needs, requirements. So we are trying to do that here. And with your encouragement, I think there are many people here who are serving in this Atal Innovation Mission. Myself, Saurabh is there, and there are a couple of other people. So we are trying our best, sir, to be volunteers for these causes. But I think it's too early, and our systems and processes are just, starting to be. So maybe, sir, we will get there sooner or later. And with that, I would like to express a heartfelt gratitude to all three of you. And all three of you in many ways manifest the heterogeneity that we have in this forum, coming from different walks of life and, sharing your problems and requirements openly. And I would like to thank three of you on behalf of India Attitude, led by Amit. Amit is over there. And InnovatioCuris, led by Dr. Singh. And that's it, sir, from my side. Thank you very much.
Sachin, I would like you to just present a memento of appreciation to all our esteemed guests.
Okay.